If you are not already aware, age-related macular degeneration, or AMD, is the leading cause of legal blindness in the world for people over 50. AMD may first be noticed when a person sees wavy lines or blurred vision. Here we observe a human retina where an ophthalmologist will see yellow deposits or drusen. As this disease progresses, bleeding into the retina occurs. As we watch this progression on the left, we see the diminishing vision of the person on the right. MacuClear Incorporated has developed a topically administered drug for treating and preventing the progression of AMD from the early stage, or dry form, to the late stage, or wet form, and blindness. MacuClear's drug was developed by Dr. George Cho, who led the discovery of timolol, the pioneering treatment for glaucoma. The macula is an area in the retina responsible for our central vision, the kind necessary for reading, driving, and watching television. A close-up of the macula shows its critical components. Like blood vessels elsewhere in the body, the choroid vessels bring nutrients to the retina and takes waste away. As we age, a reduction in the choroidal blood flow results in a buildup of debris called drusen, much like atherosclerosis elsewhere in the body. As this buildup continues over time, the drusen increases in size, and the Bruch's membrane, a critical blood barrier, can thicken and ultimately rupture. Neovascularization, present in the body wherever blood flow is diminished, can now get through the Bruch's membrane. These new vessels are small and fragile. If they rupture and bleed into the retina, the wet form of AMD occurs and vision is lost. The fundamental difference between dry AMD and wet AMD is the integrity of the Bruch's membrane. MacuClear treats dry AMD at the earliest diagnosis by restoring blood flow in the choroidal vessels, providing anti-inflammatory and antioxidative effects. MacuClear delivers its drug topically with a proprietary eye drop delivery system. The drug gets to the back of the eye through several proven pathways. With repeated dosing, MacuClear's drug restores choroidal blood flow and removes debris and toxins. The integrity of the Bruch's membrane is maintained. AMD is thus treated at the earliest or dry stage and prevented from progressing to the wet stage and blindness.